Hi, my name is Miini. I'm a fourth-year medical student from UBC, and before medical school, I did a Data Science for Social Good Fellowship with the BC Center for Disease Control, and also I did a Master of Occupational Therapy and Bachelor of Science. Both are from UBC. Research interests lie in their intersections among public health, data science, and human-computer interactions. And specifically, I am interested in climate health and its impact on human health. So, for example, during my data science fellowship, we were able to use artificial intelligence to predict wildfire trajectories in order to plan for evacuation routes. And so that's an example of how we can use data science in public health to really leverage use of data for weather forecasting and wildfire smoke or any sort of climate related events, which I anticipate will increase in the coming years. So in terms of climate health specifically, because I spent a good amount of my formative years in a rural town, climate change impacts these rural areas a lot more than urban areas. For example, there are a lot more landslides and floods happening in rural areas, and for wildfire smokes, especially in BC, it's often exclusively in the more rural and remote areas. And so that's why I'm really interested in for change in climate in human health. And how we can bridge this with the use of data-driven, innovative technologies. And in terms of ensuring that the technologies we develop have a human-computer interaction lens in terms of user design and usability, I think it's because of my background in occupational therapy, where there's a lot of use of assistive technologies. If we can make and design technical solutions that can be used by people with different abilities, then it could be used and enjoyed by everyone as well. And a lot of these technological solutions will be really helpful for improving health access for rural and remote populations. Yeah, so I was very fortunate to have met Rohit Singla and also Ricky who was in the previous episode, so please check it out. They really started introducing the concept of artificial intelligence and data science to medical students, and I was roped in to help with the workshop series. We did a national survey looking at medical students and allied health students' perceptions of AI and its implications in their future career and education. And we were able to get over 2,000 responses from students across Canada, and students told us how they want AI to be introduced in their curriculum, and also how they anticipate that AI will become a significant part of their career. Also, potential job displacement, potential implications on the introduction of AI, and privacy and confidentiality concerns and ethical implications. So all of those we were able to incorporate into future AI for healthcare workshops. Now I'm hoping to work on actually tailoring AI workshops for allied health students, because they often have a different focus, and I think healthcare would really benefit from interprofessional and multidisciplinary collaboration between physicians with other specialists. It's important to think about relating technical expertise with clinical relevance, because a lot of times a lot of ideas work great in a vacuum, but when you introduce it and want to implement it into a clinical setting, there are a lot more constraints and restraints that you'll have to work with. So being able to be adaptable and make sure that you can pivot your research to emerging challenges and opportunities. With newer technologies becoming more prevalent, be prepared to be adaptable and change your study, design, and relevance as these things will come up.